Dapat na raw pong ikabahala ng pamahalaan ang nakikitang mabilis sa pagtaas ng COVID-19 cases sa probinsya ng Cebu kung hindi ito maaagapan ayon sa pag-aaral na ipinalabas ng UP OCTA Research Team. Maaari pa itong umabot sa 400 daily cases sa loob lang ng 2 linggo. Para ipaliwanag po yan, makakausap natin sina Dr. Guido David at Dr. Benjamin Ko ng OCTA Research Group. Magandang umaga po sa inyong dalawa.
Yeah, good morning.
Apo. Dr. Guido, can you explain to us kung ano po yung current situation sa Cebu Province pagdating po sa COVID-19 transmission sa lugar at gaano kaseryoso po ang sitwasyon nila doon?
Actually, una nating tiningnan is Cebu Province pero nung may feedback na tayo, tiningnan natin ng mabuti in detail, more granular, and nakikita natin yung increase nangyayari sa Cebu City. Doon yung karamihan ng new cases. In fact, ngayon, they're averaging sa Cebu City more than 90 cases per day over the past week. Ang reproduction number nila sa Cebu City is 1.7, positivity rate is 7% and tumataas. Ang indicator nila na okay is yung hospital occupancy is mga 30%, pero yung attack rate sa Cebu City is nasa 7.6 per 100,000, and it already puts it near the high-risk classification ng Department of Health. So, yun yung nakikita natin, patuloy siyang tumataas. And ang worry natin is baka ma-overwhelm yung healthcare at some point. So, remind lang natin yung mga citizens sa Cebu City to practice yung mga health protocols, social distancing, face mask, and face shield.
Opo, para po kay Dr. Ko, masasabi bang galing pa rin ang surge na ito mula po dun sa holiday celebration sa bansa? O tapos na po yung tinatawag nating holiday surge at posibleng naging masyado pong kampante ang ating mga kababayan kaya may pagtaas po ng bilang ng COVID-19 sa mga probinsya?
Well, it's possible that it could still be remnants from the holiday surge. Lalo na kung titingnan natin, medyo malapit pa din tayo doon sa timeline na yon. But Professor Guido is correct also when he pointed out that Cebu City alone is the area na medyo mataas yung primary mover ng mga kaso sa province of Cebu lately. There's another thing also that is worrisome because the replication is compared sa Disyembre, medyo biglang tumaas ang replication ngayon, ngayong Enero. So because of the presence of the variant already in the country, I think this is something worth exploring at the same time. We're not saying it is in Cebu. What we are just saying is medyo nakakabahala kasi medyo nagpas na din yung timeline unless what we are getting from the Department of Health are medyo late na also, no? Kasi pwedeng yung datos na dumarating sa kanila, yung mga nakaraan pa, ngayon lang nila nire-record lately. So the other variable there is yung medyo pagtaas. Yung medyo pagtaas is dahil meron na tayong presence of the variant in the Philippines, one thing that we will need to explore is the question of whether this is present also in the province of Cebu.
Opo, para naman po kay Dr. Guido, kung sakaling hindi daw po maagapan yung pagtaas ng kaso sa probinsya, ano ang worst case scenario na pwede pong mangyari?
Well, right now kasi yung rate of increase niya it's doubling more or less every 2 weeks and medyo mabilis yan. And these are similar patterns na observe natin sa Mountain Province. Kaya natin nasabi na this was an area of concern yung sa Mountain Province and nakita nga na may UK variant sa Mountain Province. So right now, if it follows that pattern, by after 2 weeks, baka nasa 200 cases per day na sa Cebu City. And this is a lot kasi this is about the numbers ng Cebu City nung nag-ACQ sila last time, around June to July. And I'm sure mas scaled up na yung health capacity nila ngayon. Their testing is more scaled up than before, and they have the contact tracing infrastructure. Pero at the same time, 200 cases for a city like Cebu City, that is a lot already. I mean, to compare, Quezon City is averaging about 90 cases per day, and Quezon City has a much higher population compared to Cebu City. So Cebu City, nag-average na rin ng 90 cases ngayon. So they're about the same na in terms of raw numbers, pero mas malaking population ng Quezon City.
Opo, Dr. Ko, sinabi po ni Cebu Governor Gwen Garcia na may surge man sa COVID cases sa probinsya, ay mababa naman daw po yung mortality rate at mataas din yung recovery rate, kaya walang dapat ikabahala. Mababang percentage lang rin umano yung active cases nila kung ikukumpara daw po dun sa 3.2 million population ng probinsya. Ano po ang reaction nyo dito?
Well, that is good that their mortality rate is low, which means that the cases kasi may probably be due to contact tracing, which means that most of the patients that they are picking up are those that they may have contact traced or are actually mild cases. And that is good. But to compare apples and oranges, we always make sure that we have to remember that the 3.2 million people in the province of Cebu is Quezon City's population alone. So, tama si Professor Guido, when you talk about it and you look at the comparative data, yung 200 plus cases, nakakabahala kasi isang buong probinsya yon habang isang syudad lang yon sa Manila.
Opo. Pero Dr. Ko, bukod po sa Cebu, ano po yung mga nakikita ninyong areas of concern over this past few weeks? Meron din po bang mga lugar na masasabing gumaganda naman ang sitwasyon sa laban dito sa COVID cases?
Well, kasi I have to wait for the data drop now of the Department of Health the following day because they don't announce anymore the top 5. So for yesterday's data, what we're seeing is medyo mababa yung kasos sa National Capital Region, and I don't know if Professor Guido will agree with me. Kasi mas konti talaga. The National Capital Region is reporting about less than 20% of the total cases now in the Philippines, which is a very good sign. But the bad part there is that when I see the numbers na mahigit na 2,000 po yung mga kaso, alam ko na medyo mataas na sa iba't ibang karating probinsya at rehiyon. So yun yung mas nakaka-alarma. Maganda nga at mas mababa na sa National Capital Region.
Opo. May tanong lang po si Red Mendoza ng Manila Times para po kay Dr. Guido. Ano daw po yung inyong reaksyon sa mga panawagan ng economic cluster ng gobyerno na i-MGCQ na ang Metro Manila soon? Ano po yung ina-expect natin possible increase pag nag-MGCQ ang Metro Manila nito nga nung Pebrero at irerekomenda pa rin po ba natin yung GCQ by next month?
Yes, and before I answer yung question ni Red Mendoza, just like to add sa sinabi ni Dr. Ko na things right now are medyo flat yung trend sa Metro Manila. I echo what he's saying. Kasi yung reproduction number in Metro Manila is 1, so it means hindi tumataas pero hindi rin bumababa. It's more or less stable, and we're seeing the same patterns elsewhere. So in fact, Cebu City, and aside from maybe Pasig sa Iloilo, and right now just today we're also noticing an increase in Tuguegarao. So those are concerns. As for yung Metro Manila, I think it's too early to risk an MGCQ at this stage. Lalo na the vaccine rollout is about to happen. So unahin muna natin yung vaccine rollout. We understand yung economy, but the economy will recover more quickly once we start vaccinating more people, and that's why it's important for us to have this rollout program in place. It's also important na wala tayong surge nangyayari. We can't risk a surge while we're rolling out the vaccine kasi it will delay the process of vaccination, the rollout. Kung na-overwhelm yung hospitals natin and yung mga doctors nagkakasakit. So it's better na we keep it status quo. I mean, Probably just going to be only a few months when you start ng vaccine rollout. And then once we have that, it would be easier for us to talk about relaxing the economy even further.
Opo. Para po kay Dr. Ko, 1 year after ng unang kaso po ng COVID-19 sa bansa, masasabi ba na ayon po sa mga datos na naging sapat po ang response ng gobyerno sa pandemya?
Well, considering kasi the limitations na meron tayo sa ating bansa, I would probably say that the lockdowns are the only measures that we were able to utilize. However, I think we need to revisit kung ano ang dapat natin i-improve doon sa ating mga health protocols para ma-improve natin ang both the economic and the health sector. Kasi the longer the lockdown is, I know that the economy is also on the front line na napatamaan dahil dito sa pandemya to. So I think we need to revisit, and the IATF may need to recalibrate and find out what are the better measures. And I echo Professor Guido's statement that maybe the vaccine rollout is something that we are all looking forward to. The next part of the program is to encourage more people to get immunized and to get vaccinated. Kasi as we all know, na the vaccine hesitancy is quite high currently. And mahirap po control ang pandemya pag masyadong marami po ang nagkakasakit. So we have to bring and make sure we keep the numbers down, we bring down the numbers as we roll out the vaccine program.
Opo, Dr. Guido, ito pong pag-lift naman ng travel restrictions sa higit 30 na bansa na may UK variant. Simula ngayong araw, ano po yung magiging epekto nito base sa inyong pag-aaral?
Well, yung travel restrictions, yung pag-lift niyan, it definitely carries a lot of risk. And while we support what the government's decision is, at the same time, we are aware na it carries some risk. Of course, we all are also aware na we can't have a travel ban forever, especially sa mga returning Filipinos. And right now, what we have to focus on is the implementation of yung border controls natin, making sure that yung passengers comply with the mandatory quarantine period and yung testing is done. Kasi ang nangyari before, we were testing once, and then pag negative sila, sometimes I think nakakalabas na yung mga travelers. But it turns out that sometimes they test negative on their initial test kasi yung viral load nila is low at that point in time kasi maybe kakakuha pa lang nila ng virus from other sources. And then after a few days, they build up the viral load and then they start showing symptoms. So kaya important na they could either have a second test on the 4th or 5th day, and then if they don't have the second test, they have to have the mandatory quarantine period. In fact, in other countries, it's 21 days. Pero sa atin, 14 days quarantine period. That's observance strictly. It's the strict implementation. And if we follow those strictly, it's possible that we might not have the expected surge or increase in cases if these are followed to the letter.
Opo. Para po kay Dr. Ko, may projection na rin po ba kayong ginagawa kapag dumating na yung bakuna ngayong buwan? At ano po ang sa tingin nyong magiging senaryo?
Well, number one, ang pinagdadasal natin lahat, sana dumating muna yung bakuna. Tapos marami magpapabakuna. Kasi yun lang naman there are only two endpoints to the vaccine. Tatandaan natin na yung herd immunity ay hindi po pwedeng mangyari sa COVID vaccine. Ang dalawang endpoints na makikita natin dito ay na ginawa doon sa mga clinical trial ay number one is to decrease the severity of the infection. So kung mababawasan yung pagiging severe ng infection, kung sakaling magkaroon tayo ng COVID, ay magandang senyales yun kasi that means that we will have less deaths, we will have less people that will get severe infections and will need hospitalization. So that's one of the most important parameters. And of course, second is that they don't get sick.
Opo,
No?
kunin ko na
So
lamang.
that's the second hopeful endpoint that we have.
Opo, kunin ko na lamang po parting message po sa inyo ni Dr. Guido and Dr. Ko. Unahin ko po si Dr. Guido.
Yeah, so just a reminder na the virus is still here, and whatever happens, whether we have the original variant or the new variant, it doesn't really change our approach to the way we manage the pandemic. Dapat continued implementation of health protocols yung gagawin natin, continued compliance. So let's all wear the face mask and the face shield when we go out, practice social distancing, avoid large crowds as much as possible, and then i-limit natin yung time natin outdoors kung hindi naman necessary. I mean, we're not advocating for any type of lockdown sa places na yan. I mean, it's a decision of the local government. Yun nga, our concern is mostly a reminder to the public to be extra mindful of the of the health practices and to be vigilant.
Opo, Dr. Ko?
Kahit na po may bakuna na tayong darating o magkakaroon na tayo ng immunization program, ay importante pa din na tandaan natin yung apat-apat na sinabi ni Professor Guido a while ago. That's vital dahil the vaccine is not a guarantee that you will not get COVID. It will just make it milder. And hopefully, it is effective enough for us not to get it. That's the best case scenario. But in any event, we have to remember that the pandemic is still around. We still do not know a lot about it, and that there are still a lot of variants that are affecting the outcome globally. So, importante po na yung nandito nga sa inyo, mask, hugas, iwas. Yan ang pinaka-importante sa ngayon.
Okay, maraming salamat po Dr. Guido David at Dr. Benjamin Ko mula po sa OCTA Research Team. Maraming salamat po, mabuhay po kayo.
Salamat din po.